Okay, there we go. All right. Well, hi, Shauna. Thank you so much for meeting with me today. Really appreciate it. So this is just a interview about public health, interviewing a public health expert for my leadership and public health class. I am in the Masters of Public Health program at SIU. So again, thanks for your time today. And I'll kind of let you take it away if you could just introduce yourself a little bit.
My name is Shawna Debolt, and I have worked here at Jackson County Health Department. This is my going on my fifth year. I'm in my fourth. Um, and I am a disease intervention specialist here at Jackson County. I started as the COVID-19 response division supervisor in 2020.
Okay, great. Well, great. So if you could just tell me a little bit more about kind of how your role at Jackson County has changed over the past almost 5 years. So you started during COVID, and then kind of how has your role progressed or changed over time?
So I started during COVID, and I was managing a team of 18 people at that time who were charged with protecting public health throughout the pandemic. We had case investigators and case managers, contact tracers, a couple of IT people, and we provided guidance to the community, schools, long-term care facilities, and then the general public. So providing quarantine information, isolation information, and overall health information at the time. So as the public health emergency ended, as vaccine became available, I transitioned into my current role, which is disease intervention. So now I work with sexually transmitted illness infections, syphilis in specific, which decided to rear its head in 2022. I think in 2013, our cases were all but eradicated. I think we had like 6 cases in the state, the county of Jackson County, which is about 50,000 people. And in 2022, I believe we ended somewhere 5 cases, and right now we're sitting at about 60.
Okay, wow. Well, I'm going to ask you more about that in a minute because one of my things I want to know a little bit more about are what are some trends that you're seeing in your current work. So I'm going to get back to that, though. I have some other questions I wanted to ask you. Before you were at Jackson County, did you have any other roles in public health?
No, my degree is in speech language pathology. I got my bachelor's of science. I wanted to be I thought at the time, I really focused in audiology. So that was my goal, and life took me in different ways. I ended up moving to Florida and that. So no, this is my first step into public health.
Okay. And so your undergrad degree is in speech language pathology. Did you end up going back to school for anything in public health, or just the background in audiology kind of translated into public health?
Yes.
Cool. Okay. I didn't know that about you. That's great. Okay, awesome. Well, so that's a good question for me to lead into now is, you started out being interested in, communication disorders, audiology, things like that. What made you interested in public health, and what kind of caused that switch?
So like I said, I moved to Florida, finished my degree at UCF, and lived there. In 2018, my mom became ill, so I moved back here I started back and forth in between here and Florida. And we found ourselves here when the pandemic happened. So I have always been, I can't just sit and watch or wait. I need help. I need to be involved. So we were here and I said, okay, we are stuck here. We're going to be here and I need to be involved. So I started researching ways to do that. You know, at the beginning it was making masks and volunteering my efforts in any way that I could. And then I found out that this whole opportunity for contact tracing was available here at Jackson County. So I said, okay, I'm gonna do it. What can I do? How can I do it? And that's where I met Paula. And the rest is history. In between, you know, I lived in Florida, so I started working for Disney because that's what you do when you live in Florida. You work in hospitality.
Sure.
And I started my career, took a complete left turn, and I began retail management through Disney. And I started as a part-time salesperson. I drove the monorail and I worked my way through there. And then I started, part-time management of shift, and then a manager of the store. And then I ended up that I was a district manager for a retail company for many, many, many years, and got here. And that was no longer something that I knew was happening. And I said, okay, so here we are. What's next? And that's how I came to public health as the supervisor of COVID tracing division.
All right. Well, and I can remember, well, for anyone viewing this interview, my mom is Paula Clark, who is the interim administrator at Jackson County. So I remember that time very vividly. And she at that time was like trying to get me to become one of her contact because I mean they were so shorthanded and there was so much turnover. I can just remember what a trying time that was. So for you to be overseeing all the contact tracers had to have been quite a difficult job. So thank you. It's from someone in the public, because Jackson County had an incredible response to that emergency, better than a lot of the other counties in the area. And I know that even now they are being commended for their efforts. You guys are being, commended for your efforts during that time. So I learned a lot just as, a community member during that time. And I was already interested in public health, but then watching, so many people that I'm close to, and even just acquaintances, like all of my mom's coworkers, working through that was just incredible. And it kind of piqued my interest even more. So I'm sure you're happy.
That is what I said as we were nearing the end. I said, Paula, what can I do? Where can I be of help? Where can I be of service? Because this is now, I don't think that I could ever be not in public health.
Well, I'm glad to hear you say that. Because my interests are, heightening with time. I've always had an interest in it naturally because of my parents, but then with COVID, I really got more interested, and it's just increasing by the day. And so I'm really happy to hear from someone who wasn't necessarily in public health before, although you were in healthcare to some point, which is my background, direct patient care, and then now trying to make the switch into public health. So I'm happy to hear you say that. So that's great. Yeah, okay. Well, so kind of going back to your current role, you were talking about how syphilis has, kind of come back. Can you tell me a little bit about that trend? It sounds like that's a trend that you are dealing with specifically in your current role. Can you tell me a little bit about that? What do you think is contributing to the increased case numbers lately? And is it just Jackson County that's seeing this, or is it, across
this is nationwide? Absolutely. And don't quote me, in 2022, I believe there was 108% increase nationwide in syphilis cases and genital syphilis. Previously, the majority of people who contracted syphilis were either MSM, had sex with men, or specific people who are minority groups. So I don't know if that is the best way to say that. And in specific, what started happening 2020, 2021, 2022, that trend changed. And women, childbearing years actually became a higher demographic than men who have sex with men. So of course, as women who are childbearing years began to contract syphilis, that they equals a higher rate than more children, more babies. So that is where I forget the question what you said. Why? I believe that it's a twofold thing. You know, syphilis is called the great imitator. And a lot of the symptoms that you get early on in syphilis resolve without treatment. And they mimic other things. So people, you know, were seeking a lot of healthcare in 2020, 2021, you know, during the COVID time. So they would get minor symptoms, and those symptoms resolve without treatment. That does not mean that they are not still infected and can infect others. So, you know, when they begin to resolve, they don't seek health care and they already feel better. So, and COVID was a very lonely time for a lot of people. So people were reaching out for more intimate connection with other people. And there you go. Next one.
Yeah, I guess I didn't know that. I know I'm aware of some of the early signs of syphilis, but I didn't realize that they could, you know, become dormant or go away. And then someone may not even realize that they have syphilis, and then they're going and having unprotected sex, or, you know, sex with multiple partners. And then there you go. That's all you need for that to happen. So I know, you know, I don't know a ton about syphilis. I do know in late stage of syphilis, though, it can be deadly because it ends up affecting the brain, right? So are you seeing a lot of that, or are you, you know, hopefully seeing people before it gets to that stage and able to take care of them before it gets worse?
Luckily, we aren't seeing a lot of tertiary syphilis that has been untreated, but you know, that is years in dormancy before you get to that stage. So unfortunately, I hope that that is not going to be something we see, you know, maybe 10, 15 years from now as a result of this resurgence. So we wouldn't necessarily see them now, probably, but in the future, we haven't gotten the message. And public health is doing everything we can. I mean, we're putting the message out there that this is something that is resurgence, and trying to educate. We've done news release, press releases, and we've got on the news, Paula in specific. And we put out flyers to all of our physicians here locally in Jackson County. Then we're also for 19 counties for Care Connect. We've shared that information with the lower 19 counties, trying to impact this. But I guess for tertiary involvement, we have a little bit of time to see.
Right. I guess I didn't realize it took that long. I mean, so it has to be untreated for multiple years for it to begin to get to that level.
You can see some latent signs like ocular involvement and otic involvement and neurological involvement that can happen basically at any time. But those more severe cases that you're talking about usually happen years after being treated.
Okay. And so for you know, those watching that might not know, what are some of the first signs of syphilis?
So the first sign or symptom that you may or may not notice is a chancre. And that chancre is a sore that happens wherever you most often happens wherever you exchange sexual fluid with the person who has this. And that chancre comes and goes. And a lot of people mistake that, you know, if it's on your mouth, it it could be mistaken for a cold sore, or you know, if it's in your genital area, it could be, you know, had a razor bump, you know, an infected hair, bikini line hair or something like that, because it really doesn't cause a lot of pain and it comes and goes, like I said, without treatment. The next kind of signs or symptoms that can happen is a syphilitic rash. And a lot of times on people with low melanin in their skin, light skin, it looks kind of like a heat rash on your stomach, on your back, on the palms of your hands, soles of your feet. People who have a lot of melanin in their skin, it can be kind of brown or dark spots on their skin. Again, you get rashes for lots of reasons. It doesn't really itch, it doesn't cause a lot of pain, and it comes and goes. So if I'm otherwise feeling fine and those symptoms come and go, I may or may not seek medical attention. That's why we are constantly reminding people that if you are sexually active, even if you believe that you're sexually active with one human, you still should get sexual health testing. And that should be comprehensive sexual health testing. Wherever you're having sex, that's where you need to be tested, right?
Yes, and you know, even one step further is if you're unsure of your status, then you know you need to be having protected sex. I mean, whether you know it, those are your two pieces there that I think, you know, we know that people don't always follow. So, okay, well, thank you. I wasn't necessarily expecting to get a lesson on syphilis today, and I'm just happy I did. Okay. Great. Well, I just have one or two kind of more questions just to wrap it up. I appreciate your time so far, but can you tell me, just tell me a little bit about why you enjoy your job, the rewards and the challenges that you face in your role?
um, Gosh, after a particularly challenging day, it's hard to think about rewards. Rewards. I think the reward is knowing that even, you know, medical professionals have, a lot of people have never had exposure to syphilis up until, you know, the last 2 or 3 years, other than medical school, because it was, like I say, all but eradicated.
Sure.
So to have the opportunity to really impact and help people, that is rewarding. To give education, to help people take charge of their own sexual health, to be, you know, better steward for their own health. That feels rewarding. That feels like it is impacting more than one human at a time, right? What was the other? The challenges. I think that there are many challenges. I think the majority of the challenges in the education, a lot of people don't understand that what they have is something that can be cured. It's just going to take a little bit of effort and time to do so. And, especially my main job is to elicit partners so that I can stop the spread of infectious disease. So it's particularly challenging, especially when you're trying to speak to someone about sex. It's something that is very personal and very stigma. You know, it elicits those feelings inside of the person that you're speaking to gain their trust and help them understand the reason why you're asking all of these very personal questions. And now tell me who you've had sex with so that we can make sure that they get the testing in a very short amount of time.
Sure. Yeah, I would imagine in your specific role that you're dealing with a lot of people who may not have a great understanding of health or a very good health literacy. So then when you're trying to have a very sensitive and personal conversation on top of that, it must make it very difficult. So you have to be a good communicator to do what you do in order to, you know, get the job done and making sure that you're having effective conversations. So which, you know, your background is speech therapy. So perfect. You're good at communication.
How did I know? But
Yeah,
back in the day.
it's all lining up. Okay, well, thank you, Shauna. I don't want to go over time, so I really appreciate you taking the time to meet with me, and it's a big help to me. And you know, hopefully, eventually, I'll be a public health expert, and someone will be interviewing me. So I appreciate your help.
Thank you for calling.
Yeah. Okay. Have a good day. Talk soon.
Bye.
Bye.